I want to talk about something I have personally witnessed in healthcare. And this conversation is not just about CNAs. I've seen and heard about this issue across direct patient care. Nurses, CNAs, patient care technicians, caregivers, and other healthcare professionals who work directly with patients. I'm talking about extremely long artificial nails during direct patient care. And whenever this subject comes up, there's one response that really gets my attention. I know how to work with them. Or even, I've mastered it. You've mastered it? Mastered what? Because we're not talking about typing on a computer. We're not talking about going to dinner. We're talking about healthcare. We're talking about touching vulnerable patients, providing wound care, changing briefs, providing perineal care, cleaning patients after bowel movements, bathing patients, repositioning patients, handling bodily fluids, performing assessments, starting IVs, handling catheters and other medical devices, and performing procedures where infection prevention matters. So this isn't a CNA issue, and it isn't a nurse issue. It's a patient safety issue. I have personally witnessed a CNA providing intimate patient care while wearing extremely long artificial nails. But I don't want anyone watching this video to walk away thinking, "Oh, she's talking about CNAs." No, I'm talking about anyone providing hands-on patient care. If you're an RN, LPN, CNA, PCT, caregiver, or another healthcare professional working directly with patients, the same basic question applies. Are our personal choices introducing an unnecessary risk into patient care? That's the conversation. And I have absolutely nothing against beautiful nails. This isn't about whether long nails look good. Some of them look amazing. This is about whether they belong in certain clinical situations. Think about the work healthcare professionals actually perform. A nurse may be assessing wounds, changing dressings, handling IV equipment, administering medications, working with catheters, assisting with hygiene, or performing other hands-on procedures. A CNA or PCT may be changing briefs, providing perineal care, bathing patients, repositioning them, cleaning patients after bowel movements, assisting with toileting, and handling bodily fluids. Different roles, different scopes of practice, but the same patient's body, and the same fundamental responsibility: protect the patient. Now think about an elderly patient. Older adults can have very fragile skin. Their skin may be thinner and more susceptible to friction, bruising, and skin tears. Imagine an elderly patient who has just had a bowel movement. They cannot get themselves out of bed. They cannot clean themselves. Maybe they have dementia. Maybe they can't communicate clearly. Maybe they're completely dependent on the healthcare worker standing beside them. Someone has to remove the soiled brief, turn the patient, clean the buttocks, clean the perineal area, clean between folds, remove the stool, dry the skin, reposition the patient, and put on a clean brief. Now imagine extremely long, pointed artificial nails underneath the gloves performing that care. Yes, you're wearing gloves, but the glove doesn't make the nail disappear. The length is still there. The hard point is still there. And the patient isn't a mannequin. Patients move. A confused patient can suddenly turn. A patient with dementia may become frightened and pull away. A patient in pain may jerk unexpectedly. And one wrong movement could potentially scratch or injure already fragile skin. That's especially concerning when you're working around an area exposed to stool, urine, moisture, friction, and microorganisms. The patient came to us because they needed care. Our choices should not introduce an unnecessary risk of another problem. Now let's move from intimate hygiene to nursing care. Imagine a nurse caring for a wound while wearing extremely long artificial nails. The wound is already a break in the body's protective barrier. Maybe the patient has diabetes. Maybe they're immunocompromised. Maybe they're recovering from surgery. Maybe they're elderly. Maybe that wound is already difficult to heal. This is not the time to ask, "Can I successfully work around my nails?" The better question is, am I creating the safest possible environment for this patient? Those are two very different mindsets. And then comes the most common defense. I'm wearing gloves. Of course you should be wearing the appropriate gloves when they're indicated. But gloves are a protective barrier. They are not magic. What's underneath them still matters. The CDC has specific recommendations concerning artificial fingernails in healthcare, particularly for healthcare personnel having direct contact with patients at high risk of infection. There is a reason fingernails are part of infection prevention guidance. Microorganisms can exist around and underneath fingernails, and artificial nails have raised infection control concerns in healthcare environments. Then there's another practical question. What happens to the glove? Look at an extremely long, pointed nail. Now imagine that nail pressing against the inside of a thin, disposable medical glove throughout a shift. The professional question shouldn't be, I've done this 1,000 times and nothing happened. It should be, why introduce an avoidable concern when my job is to reduce risk? Healthcare isn't about proving how skilled we are at working around unnecessary hazards. It's about removing unnecessary hazards whenever reasonably possible. And I want nurses to really hear this part. Nurses carry enormous responsibility. Patients trust you with medications, wounds, lines, tubes, assessments, procedures, education, and decisions that can directly affect their outcomes. So infection prevention isn't a small cosmetic issue. It's part of professional patient care. And the same applies to CNAs, PCTs, caregivers, and everyone else providing hands-on care. Our responsibilities may be different. Our scopes of practice may be different. But when our hands touch a patient, patient safety matters. Now put yourself in the patient's position. You can't get out of bed. You can't clean yourself. You're embarrassed. You're uncomfortable. Another adult has to expose and clean the most private areas of your body. You look down and see extremely long, pointed artificial nails underneath their gloves. Would you feel comfortable? Now imagine you have an open wound, and the nurse approaching your dressing has extremely long, artificial nails underneath their gloves. Would you feel comfortable? Maybe your answer is yes. Maybe it's no. But now change the patient. That's your mother, your father, your grandmother, your grandfather, your child, your spouse. Would your standard change? That's why I believe every healthcare professional should ask, would I want this done to someone I love? Not, can I get away with it? Not, everybody on my unit does it. Not, management doesn't care. And not, I've mastered it. The question is this the safest professional choice for my patient? And again, I am not attacking healthcare workers who enjoy beautiful nails. I love seeing people express themselves. But healthcare comes with professional boundaries. There are things we may choose outside of work that aren't appropriate for every clinical environment. That's part of being a professional. And your individual workplace may have policies regarding artificial nails, nail length, hand hygiene, jewelry, gloves, and direct patient care. Know your facility's policy. Follow it. And understand why infection prevention rules exist. Now, what should you do if you're a nurse, CNA, PCT, caregiver, patient, or family member, and you genuinely witness something you believe creates a patient safety concern? Report the concern through the proper channel. Depending on the situation, that could be the charge nurse, nurse manager, director of nursing, administrator, infection prevention department, compliance department, patient safety office, patient advocate, or your facility's reporting system. Report facts. What did you personally observe? When did it happen? Where did it happen? What type of patient care was being performed? Was there an injury? Was there an immediate risk? If the organization needs to identify the healthcare worker involved in order to investigate, provide the person's full name or identifying information privately through the appropriate official reporting process when necessary. But don't put people's names on social media. Don't encourage harassment. Don't exaggerate. Don't report rumors as facts. This should be about patient protection, not personal revenge. And if you're a healthcare worker who's afraid to speak up because you fear retaliation, Find out whether your organization offers confidential reporting, an ethics hotline, or another protected reporting process. If you believe a serious patient safety concern isn't being appropriately addressed internally, determine which outside authority handles that type of complaint in your state. Depending on the situation, that may be a state health department, healthcare facility regulator, professional licensing board, long-term care regulatory agency, or another appropriate patient safety authority. The correct agency and reporting process vary by state, profession, and facility type. Some reporting systems may permit confidential or anonymous complaints. If you're concerned about retaliation, find out what protections and reporting options actually apply before making the report. And if a patient is in immediate danger, don't simply wait for a complaint to be processed. Follow the appropriate emergency and supervisory escalation procedures where you work. Get the patient help. The purpose of reporting isn't, "I want this nurse fired." It isn't, "I don't like this CNA." It isn't, "Let me expose this person online." The purpose should be, "There may be an unsafe practice here. Please investigate it and protect the patient." That's the difference between patient advocacy and personal retaliation. So I want to open this discussion to the entire healthcare community. Nurses, RN and LPN, CNAs, PCTs, caregivers, and other direct care healthcare professionals. What do you think? Should extremely long artificial nails be permitted during hands-on patient care? Does the type of care matter? What does your workplace policy say? Have you witnessed extremely long nails during wound care? Brief changes? Perineal care? Bathing? Catheter care? Other direct patient care? And here's the question I want everyone to answer. Would you personally be comfortable receiving intimate care or wound care from someone wearing extremely long, pointed, artificial nails? Keep the discussion respectful. Don't identify individual healthcare workers in the comments. We're discussing the practice, not conducting a public trial of individual people. Because this isn't nurses versus CNAs. It isn't management versus staff. And it isn't fashion versus people who don't like fashion. It's about patients. When another human being is depending on our hands for hygiene, dignity, treatment, infection prevention, and safety, our professional responsibilities have to come first. So when I hear, "I've mastered working with my long nails," I still have one question. You mastered what? Because healthcare isn't about mastering how to work around an unnecessary risk. It's about giving the person lying in that bed the safest care we reasonably can. Patient safety over style. Every time.